Dear students, now I am going to take 12 Paduvarmas. First, Thiruvattar. Thiruvattar anatomical correlation is fronto-nasal suture. இரண்டு புருவங்களுக்கு மத்தியில் ஓர் நெல்லிடை கீழ் இந்த ஃப்ராண்டல் போனும் நேசல் போனும் மீட் பண்ணுற இடத்துல ஒரு சூச்சர் இருக்குது. அந்த சூச்சருக்கு அடியில் தான் இந்த படுவர்மம் இருக்கிறது. இதுக்கு பேர் திலர்த காலம் பேர். அடுத்த படுவர்மம் நட்சத்திர காலங்கிற படுவர்மம் இருக்குது. இது எங்க இருக்குது அப்படின்னா lateral cavity of the eye. Lateral cavity of the eye, nearby there is a depression. Is called Nachatra Kalam. This is Nachatra Kalam. கண்ணுக்கு பக்கவாட்டு குழியில் தொட்ட மாதிரி ஒரு குழி இருக்கும், ஒரு டிப்ரெஷன் இருக்கும். அந்த இடத்துக்கு பேர் தான் நட்சத்திர காலம். அடுத்து நம்ம பார்க்க போகிறது செவிக்குற்றி காலம். செவிக்குற்றி காலம் எங்கே இருக்குது அப்படின்னா நம்ம காதோட கீழ்மடலை ஓப்பன் பண்ணோம்னா அந்த கீழ்மடல் கீழ் ஒரு குழி இருக்கும். There is a depression behind the lower earlobe. This anatomically, this place is called stylomastoid process. Stylomastoid foramen here. The facial nerve piercing through the stylomastoid foramen. Next one is Uraka Kalam. There are dual Varma of Uraka Kalam just behind the anterior portion of the lower mandible. Next Paduvarmam is Thummikalam. Thummikalam is suprasternal notch. Anatomical correlation, suprasternal notch, where the upper portion of the sternum there is a depression. This is Thummikalam. Next one is Nervarmam. Nervarmam just below the Kumbuvarmam. Kumbuvarmam means anatomical correlation, Sipoid process. There is a depression 2 finger below the Kumbuvarmam. Is called Nervarmam. This place is Nervarmam. Next one Paduvarmam is Urmikalam or Pandrivarmam. 4 finger above the umbilicus. 4 finger above the umbilicus there is a varmam, is called Urmikalam or Pandrivarmam. This place. Next Paduvarma is Kallidai Kalam. Kallidai Kalam 6 finger below the umbilicus. 6 finger below the umbilicus. Here that place happens. 4 finger below the umbilicus is Mutrakalam. From the Mutrakalam, 2 finger below the Mutrakalam is Kallidai Kalam. Kallidai Kalam is a dual Varma. If any heat or blow happen in the testis will go upward. That is called ascending testis. The next one is Adappa Kalam. Adappa Kalam, the Varma is below the mid axillary line, 5 finger below the mid axillary line, and also a line from nipple, also the line from nipple. Here this place is adapakalam. Next, there are two Suruki Varmas. One is small Athichuriki and big Athichuriki, Cheri Athichuriki and Valiya Athichuriki. 9 finger below the nipple, the straight line or midline from the clavicle. 9 finger below the nipple, there is the 11th distal part of the floating rib. There is the finger-like projection here. This is called Mundalambu. 1 finger inferior to the Mundalambu is called Valiya Athichuriki. Valiya Athichuriki. Valiya Athichuriki behind the Mundalu Varmam is the floating rib. There is the finger-like projection here. 2 finger below, there is a Varma called Seriya Athichuriki. Athichuriki means, Asti means bone, shrinking of the bone after injured. After injured this place, the length of the bone is shrinked. So that is called Asti Suruki. Then last 12th Paduvarma is in back. Valai mudinda pagudiyil pidari. There is the external occipital protuberance, anatomical correlation. External occipital protuberance. Here there is a protuberance of the bone of occiput. It's called pidary column. That's all we have seen 12 Paduvarmas. Dear student, now I am going to take 8 thatuvarmas. Thatuvarmas from blow. The first thatuvarma is cervicutary column. We already discussed, I indicated the cervicutary varma. Below the earlobe, there is a stylomastoid foramen or stylomastoid process. This is one thatuvarma. Next one is Uraka column. Next one is Uraka column. There are dual varma of Uraka column just behind the anterior portion of the lower mandible. Anterior portion of the lower mandible. In behind there is digastric muscles, anterior digastric muscles are there. Here there is Uraka column. Is also Paduvarmam and Thatuvarmam also. Next one is Simai Varmam. Simai Varmam. Where is Simai Varmam means the tracheal ring. This is tracheal ring. Dual Varma, Thatuvarma, Simai Varmam. This is Simai Varmam. This is Simai Varmam. Bilateral tracheal ring. This is Simai Varmam. Next one is Nair Varmam. Nair Varmam also a Thatuvarmam. We already explained in Paduvarma. Nair Varmam, 2 finger below the C.G.O process or 2 finger below the Kumbha Varmam. Here. Next one is Kallidai column. Kallidai column is here, that is Paduvarma. Now we are seeing to thatuvarma. There is other one varma is urumikalam. Here urumikalam. 4 finger above the umbilicus. 4 finger above the umbilicus is urumikalam. 1, 2, 3, 4, 5 and 6. Thatuvarma is called adapakalam. You already indicated this point. 5 finger below the midline anterior axillary midline. This is adapakalam. 6th thatuvarma. The 7th thatuvarma is 1 finger under the mundalambu, that is called vali athichuriki. Next one is siri athichuriki. 2 finger below the vali athichuriki is siri athichuriki. So 8 thatuvarmas happens here. We have seen 8 thatuvarmas. Now we are going to deal about thoduvarmas. Here I already mentioned Tiladagalam. This is Tiladagalam. Half finger breadth above the Tiladagalam is Kumbudugalam. Kumbudugalam. Half finger above the Kumbudugalam is Pachivarmam. Pachivarmam. A midline in upper above the hairline is Pachi Nervarmam. Pachi Nervarmam. The center of the eyebrow is Puruvavarmam. The dual varmam, both sides. Puruvavarmam. This is supra-orbital notch. Here supra-orbital foramen also. In downline, likewise the infra-orbital notch. Infra-orbital notch. This is Mai Anuga column. 1 finger breadth bilaterally. The varma is Poruthuvarmam. Poruthuvarmam. This is a dual varmam. Poruthuvarmam. The two nasal bones are Kannadi column. Kannadi column. Kannadi column. Here there is a nasal bone. Where the nasal bone ends, there is a depression. There is a depression. You feel this depression when you press your finger. This is called Balavarmam. Balavarmam. In Balavarmam, there are 2 kalai, Idagalai, Pingalai. The Kombu Piri column. Kombu Piri column. This is left, this is right. Kombu Piri column. In tip of the nose, Komberi Moku. Komberi Moku. In bilateral yellow nasi, behind the yellow nasi, there is a depression. This is called Minvetti column. Minvetti column. Below the tip of the nose, there is a varma Sundigai column. Sundigai column. Where the upper lip and the border of the nose meets the junction, here varma Siva Varmam. Siva Varmam. This is a very important varmam. The central portion of the body varmas are very, very important. It is very related to the brain. Next one is Ottuvarmam. Ottuvarmam means mandible. Anterior border of the mandible. This is Ottuvarmam. One finger breath bilaterally there is a varmam, dual varmam called vettu varmam. This is mandible foramen. Here the kombupiri column, half finger, arai keel, half finger down. There is a depression both left and right called Valamurti Edamurti column. Valamurti Edamurti. This is maxillary bone. Next varma is Kavalpatru. Bilateral border of the lip. Here. This is a dual varma, Kavalpatru, Kaval Adangal also. 3 finger sideline from the borders of the lateral lips. It's a dual varma, Kavalpatru. This is. The next is Annangalam. Anatomical correlation, temporal fossa. There is a depression in temporal region, temporal fossa. Annangalam. Inside of the ear, in upper depression is Ayamai. Here Asan column. The center behind the tragus is Ayamai. The tragus is Kutri varmam. This portion is temporomandible joint, TM joint. Temporomandible joint, Ayamai also Adangal. The next one is behind the ear there is a bony ridge, is called Kamburi column. Likewise, under the lower eyelid there is the Kamburi column. Here is Kanburi column. Maxillary bone ridge. This is Kanburi column. You just feel a bony edge. Kanpuri column. Kanpurikum column. This is. Three finger below the Sevikutti called Konasanni. Here Alavadi bone, so Alavadi Konasanni. Very, very dangerous varma, thoduvarma. 2 finger below the Alavadi Konasanni is called Udira column. Udira column also a dangerous one. Here it's a dual varmas. Chevikutri, Alavadi Konasanni, Udira column. These are very, very important varmas. Dual both side. Then we are deal about throat. In throat there is a eminence, laryngeal eminence called Munkokki column. Above the laryngeal eminence called Munkokki column. The projection of the hyoid bone. Projection of the hyoid bone is the projection of the hyoid bone is Sangu Tirikalam. Sangu Tirikalam. In Thatuvarma, we already seen Simai Varmam. Simai Varmam. Next, where the two clavicle meeting with manubrium sternum, sternoclavicular joint. This is Kalaladi Varmam. Kalaladi Varmam. Where the second intercostal space meet the sternal notch is called Kadirvarmam. Kadirvarmam. Where the third intercostal space meeting with sternal notch is called Kadir Kama Varmam. Kadir Kama Varmam. Below one finger breadth, the Kadir Kama Varmam, there is a Mun Punul Varmam. There is a Mun Punul Varmam. Mun Punul Varmam. End of the sternum, there is a process, Sipoid process. This process is a projection like Kumbu. So this is Kumbu Varmam. Sipoid process is Kumbu Varmam. In nipple, the center of the nipple, there is a Varma called Dusika Varma. Dusika Varma. Two finger around the nipple, they are 8. There are 8 Ashtavarmas. There are 8 Ashtavarmas. Two finger below this Anumar Varma, that is Maru Varma. Two finger above Asti Varma. Here Dudi Varma. Here Pidi Varma. Here Kalalai Varma. Here Maru, that means Anumaru. This is yellow. Asti, Dudi, Pidi. Here Valai. Here Molai. So 8. Asti, Dudi, Pidi, Maru, Valalai and Valai Mulai. These 8 Varmas. In other synonym is Ramar Varma, Ravana Varma, Cheetah Varma, Sukri Varma, Vali Varma, Padala Varma, or like this. This is Ashtavarmams. Next, one finger below the Maru Varma, Anumar Varma, the Varma is called Nenjadappan Kalam. Nenjadappan Kalam. Here Vila Adappan, here Nenjadappan. Nenjadappan is highly dangerous, very, very important. The 11th floating rib, distal part of the 11th floating rib is called Mundellu. In tip of the Mundellu, a Varmam called Mundellu Varmam. One finger laterally to the Mundellu Varmam is Pallai Varmam. Pallai Varmam. Pallai Varmam. One finger laterally is Kai Katti Kalam. Where we Kai Katti Kalam. Kai Katti Kalam. This navel is Annakalam or Undipulai Adangal. The umbilicals also Adangal. Below the 3 finger from umbilicus is Mutrakalam. A 40-degree lateral bilateral is a petty column. 4 finger from the umbilicus is petty column. Anterior superior iliac crust here. It is called Arayapu column bilaterally. This is Arayapu column. Arayapu column. You must manipulate like this. Arayapu column. To take hand varmas. The 5 fingers just below the nail bud here. Kannu varmam. That means naga kannu varmam. There are 5 fingers, 5 naga kannu varmams. There are bones here. This is metacarpal bones. Metacarpal bones join with proximal phalanges. The metacarpal bone and proximal phalanges bone where it joined. There is a bony projection. This is called knuckles. In between the knuckles called Molipiravarmam. Molipiravarmam. In lateral part of the Molipiravarmam here, Kundodiri Varmam here, lateral part of the projection in between the knuckles, Molipiravarmam, the lateral border of the Molipiravarmam, Kundodiri Varmam. Here the thumb and the index finger. So in between the thumb and index finger, the final part, there is a depression, Kai Kavali. One finger below the Kai Kavali, there is a adangal, cover adangal. Yes, here. There is a depression, cover adangal. In between the second finger and center finger, in between the center finger and second finger, there is a line and goes down. The depression is called Manibandha Varmam or Kolikalathu Varmam or Munmutu Varmam. Many names is Varmam. Very, very important. In the same opposite side, there is Thudikai Varmam. In Kavali Varmam, behind the Kavali Varmam, Ullangai Vellai. Center of the palm, Ullangai Adangal. The opposite side of the Ullangai Vellai, here Dachanai column. தட்சணை காலம். Four fingers below the Manibandha Varmam as Andai Varmam. Andai Varmam. Mulangai Kuli Varmam. Mulangai Kuli Varmam. This is cubital fossa. Cubital fossa. In front, there is brachioradialis muscle, where the brachioradialis and the brachium meeting the point is called thoduvarma. Thoduvarma. This is thoduvarma. Very, very sensitive part. Thoduvarma. Here there is a depression, Mootukuli Varmam. Kai Mootukuli Varmam. Kai Mootukuli Varmam. Center of the biceps. So long head of biceps, short head of biceps. Center of the biceps, the Mundaga Varmam. Mundaga Varmam. Two finger above the Mundaga Varmam, Poruthu Varmam. Poruthu Varmam. Three finger below the Poruthu Varmam, Asaivu Varmam. Asaivu Varmam. The center of the axilla, Kaikuli, Ganthari Varmam. Ganthari Varmam. It is very, very dangerous Varma. If any injury happens here, the total hand is disabled. Total hand is disabled. One finger below the Gandhari Varmam is Ulputru Varmam. Ulputru Varmam. Ulputru Varmam. This is Yendi column. This is Yendi column, Yendi Adangal. This is also Adangal. Yendi Adangal. Here there is a Varma, Arangu Varma. Arangu Varma. Neck to shoulder, neck to deltoid, There are three Varmas where the neck and shoulder meet. Here there is a Varma is Vilangu Varma. It's highly dangerous Varma, Vilangu Varma. Center of the trapezius called Kakatai column. Kakatai column. Here there is a Varma called Bhuja Varma. Bhuja Varma. Bhuja Varma. There are three important Varmas. Here the Bhuja Varma. Now I am going to take back Varmas. Now I saw the Muduchus. Muduchus means nerve knots. There are 5 nerve knots. One is Karnamirda Muduchu. This is the cranial end and atlas bone of the cervical vertebra. So where the atlas bone and cranial bone, there is a junction, there is a joint. Atlantocranial joint. This is Karna Mrida Muduchu. Here there is a bony projection, C7 end T1 start. This is Sara முடிச்சு. Down T10 துன்னல் முடிச்சு. Here L1, where L1 starts, that is பாச முடிச்சு. Where the coccyx starts here, coccyx vertebra, there are 4 coccyx vertebra, this is a kumbhaka முடிச்சு. There are 5 முடிches. Here are the spinal, neuro, electrical, vital energy centers. Very very important. There are 31 pairs of the spinal nerves here. In 4 finger below the saramudichu and 3 finger bilaterally, there is a Kai Suliki Varmam. Here. Straight up. Kai Suliki Varmam. This Varmam is very very important for backache and neck pain and shoulder pain. Below two finger from the Kai Suliki column, the border, lateral border of the scapula is called C.P. Varmam. In center of the C.P. Varmam, C.P. Munai Varmam. The center of the spinal cord, Nattellu Varmam. T10. T12, there is Vayu column. Here there is a depression, 2 depression, this is called Nangana Chuli. Posterior superior iliac spine. Where the left side Thivalai column only happens in the left side. So where the Thivalai column, near opposite side, there is a Punul Varmam. 2 finger below the Punul Varmam, Kili Mega Varmam. 2 finger below the Kili Mega Varmam, Kilipura Varmam. 2 finger below the Kilipura Varmam, Malapura Varmam. 2 finger below the Malapura Varmam is a Jadapura Varmam. Jada means body. Pura means to change. Jadapura Varmam. Every 2 finger. Next, Kachai Varmam. Kachai Varmam is dual Varmam. So the Kachai Varmam is here. Kachai Varmam. Where the females having the back, there is a Kachai. Kachai Varmam. This is. Now I am going to take Varmas of lower extremities. Here in sole, in sole there is a Varma in between the big toe and second toe. Here there is a Varma Ullangal Vellai. The center of the palm is Ullangal Adangal. Here Here just near the nail bed, just near the nail bed, kannu varmas, naga kannu varmas. It also in hand, fingers, naga kannu varmas. In between the big toe and second finger there is a depression called kavali, called kavali. One finger above the called kavali, vritti, vritti. The adangal also, vritti adangal. The center of the foot, padangal, padangal, nadu padangal. The ankle joint called kulachi, called kulachi. Here there is a bone called malleolus. This is lateral malleolus, this is medial malleolus. Above the medial malleolus, the varma is called madil varma, madil varma, madil varma. This is also called kan pugachal kalam, kan pugachal kalam, kan pugachal kalam. Malleolus bone called in Tamil karandai elumbu, karandai elumbu. In Adi Tamil paradumani, paradumani, padandal paradumani. Here there is a varma, kudingal varma, kudingal varma. This is also adangal also, adangal also, adangal also. 3 finger from kudingal adangal, kudingal near varmam, kudingal near varmam. The lower part of the calcaneus tendon. This is மூட்டு வர்மம், முழங்கால் மூட்டு வர்மம். 2 finger below the முழங்கால் மூட்டு வர்மம். Here is a tibial head, anterior tibial head called நாய்த்தலை வர்மம், நாய்த்தலை வர்மம். The center of the tibial bone, center of the tibial bone, குதிரை முக வர்மம், குதிரை முக வர்மம். Center of the tibial bone, there is the varma, kudurai mugha varmam. 3 fingers below the kudurai mugham, this is called Adi Siva kalam or Komberi kalam, called Komberi. 2 finger below the Komberi, Konasanni, called Konasanni, called Konasanni. Here 2 finger above the Muttu Varmam, this is Muttu Varmam. 2 finger above the Muttu Varmam, bilaterally there is a depression, there is 2 depression. This is called Gajakesari Varmam, Gajakesari Varmam. 4 fingers from Gajakesari Varmam, there is anterior component of the thigh. This is called Amai column, rectus femoris muscles here, rectus femoris. The center of the thigh is Tundu Varmam, Tundu Varmam, Tundu Varmam. There are dual Varmams. So inner center of the thigh is Ul Thodai Varmam, Ul Thodai Varmam. very very important varmam, ulthodai varmam. Here there is the calf muscle. There is a belly here, gastrocnemius belly, long gut, short gut. Here keel mannai, male mannai. Keel mannai, male mannai. The center is mulangal மூட்டு வர்மம். This is called பின்மூட்டு வர்மம். முழங்கால் குழி, முழங்கால் குழி. Two fingers above the முழங்கால் குழி. This is called வீரடங்கல். One finger above the முழங்கால் குழி, சதுரடங்கல். சதுரடங்கல், முழங்கால் குழி. This is வீரடங்கல். This is அலங்கல் points. Here there is a popliteal fossa, முழங்கால் குழி, முழங்கால் குழி. There is a popliteal fossa. Here பின்தொடை வர்மம், பின்தொடை வர்மம், பின்தொடை வர்மம். Here there is a ischial tuberosity, ischial tuberosity. There is ischial tuberosity. நாயிருப்பு காலம், ischial tuberosity, நாயிருப்பு காலம். Below the clavicle, two finger below the clavicle, there is a varma திவலை காலம், திவலை குழி. திவலை குழி is very very important. Above the cardiac plexus, very very important varma for cardiac strength. Highly cardiovascular area. திவலை குழி, தொண்டை குழி, திவலை குழி, நெஞ்சு குழி. There are three குழிஸ். குழி means பொய்கை. குழி means பொய்கை.